It's time for another edition of the Lesson T here on Claibs Online, and we're glad you're with us. And today it's time to talk a little bit about movement and your back and your spine and all that good stuff with Dr. Mike Murphy. And Doc, kind of let everybody know off the bat what you do, and then we're going to talk about your relationship with Elevated Performance and Family Golf and Learning Center.
Okay, thank you for having me, Jay. I appreciate that. So I'm a chiropractor, and I work at Performance Chiropractic. And what we do is we work with athletes on helping them perform better. And we look at what they're trying to achieve and help them achieve it. And we work with the other professionals, whether it be an orthopedist, a physical therapist, massage therapists, or trainers, whomever. And what happens is when you have a team approach, it greatly benefits the athlete.
Well, and that was leading me to what has been created by Adam and Crash and now you and other pieces of the puzzle. Family Golf and Learning Center brings it all together. It's a unique situation that, as you know, as a good player, our town really has never seen. It's kind of a game changer. Because a golfer at whatever level, at whatever interest, can get so much information.
Yep. So what happened was there's an entity called the Titleist Performance Institute, started by two guys, Greg Rose, who's a chiropractor, and Dave Phillips, who's a PGA professional. And what they found a few years back was that the professional, the teacher, was like, hey, I'm having trouble getting my student to do what I want them to do. And Greg said, that's kind of interesting. Let me see. And so what Greg was able to say is, okay, you're asking him to do X. Well, he can't do X because he can't move a certain way. So what happens is that if you lose movement in a segment, you're going to steal movement from a different segment. And in the golf swing, that's not ideal, because then you start to make compensations in your swing to try to achieve that movement. And that's where Titleist Performance Institute kind of started, and it evolved, and it's a great science. All of us are all TPI certified. And what that does then is that allows us all to work together to help the golfer. And I'll give you a little quick case in point on myself. Like I was a decent golfer, but my handicap's gone from a 1 to a 5. And when I looked at the video, I noticed, like, Adam was asking me, hey, Murphy, you got to get a little upright. You're getting really flat. And as any golfer knows, what you feel and what are real are two different things. And so then I saw the video of myself hitting the ball, and I was like, holy cow, I'm getting really flat. And what was happening was then Crash put me through the screening, and I had no thoracic spine mobility and rotation. So instead of rotating my thoracic spine, I was rotating my arms. Well, then if you rotate your arms back to get rotation, then you got to rotate them back. So I'm hitting these big pull hooks. So I get some treatment from one of my partners on my thoracic spine. Crash gives me what we call reinforcement exercises to help me get my rotation. So now when I go back and I visit Adam, all of a sudden, hey, see what I'm doing here, Murph? You're swinging more upright and you're getting spinal rotation. Well, I just couldn't physically do it. So that's what the TPI screening process does is, one, we identify what areas of your body can't move properly. We treat it, which is what Performance Chiropractic does. Crash then at Elevated Performance, then he reinforces that because he and I have conversations. And then we also have conversations with Adam or the other PGA professionals there. And we say, hey, listen, try this, try that. And all of a sudden now the student is able to accomplish something because they weren't able to move properly before. Now they can move properly, which allows them to swing properly and to make the appropriate changes in their swing that their professional is asking them to do.
All right, Doc, let me ask you this. You talked about working with athletes.
Yes.
They're guys that play 20 times a year, play with their group, want to beat this guy, that guy.
Yep.
They might be a 12 handicap.
Yep.
What can getting involved with the TPI and maybe, the thing I try and stress to people is you may have limitations in what you can do. You may not be able to take the club back to a certain point to hit at a certain distance. And once that's determined, you guys can then put together a program that can help them, right?
Yes. So, yes, you're talking, high-end athletes, so be it. But what about us people that work for a living and still want to get out and play golf? I still want to be able to perform better. I want to take $5 off of my buddies for sure. So there are some limitations that you just can't physically fix. So if somebody has a something replaced and they actually have a physical limitation, we'll have to work around that, and we'll have to work with the pro. But for the most part, whether you're somebody like me who's in his 50s, you can move better, okay? And if you move better, you can optimize your swing. Yeah, I'm not going to hit the ball as far as I did 15, 20 years ago. That's just the way it is. However, I can still hit the ball straight, and I can hit it as far as I can. So even though I'm a office guy during the week and a golfer on the weekend, you can still move better, which still allows you to swing better, which then allows you to perform better, and then you're taking the $5 from your buddies.
Well, and I don't want to get too deep, but it is somewhat important for the person to have an understanding of their body as it relates to the golf swing, isn't it?
Oh, absolutely. Because, what you feel and real are two different things. Okay. And so sometimes that's where I think teaching has developed so much because of the video, the TrackMan. We have so much feedback. But what we're doing is not only allowing the pro to help that person, perform better, is we're giving them things that they can do at home and teaching them what they need to do so that they can understand the difference.
How did you get involved in golf? Because I know you were a high-level track and field collegiate athlete. Was golf always part of your life, or did it come later?
Okay, well, I was a caddy when I was 12 years old, so I started to play a little bit of golf. However, in my teen years, I moved away from golf because I was also playing hockey, and it wasn't something that really interested me at a young age. And then when I was finishing up chiropractic school, I got reintroduced to golf again, started to like it, and being an athlete and a hockey player, it helps. And having developed some of the skills at a younger age also helped, even though I never used them for about 15 years. And just like, everybody else, you get bit by the bug. Once you're bit, you're in, so I've been full feet in ever since.
No question about it. You have been lucky enough to work with the best. I mean, the highest level athletes with the Blues, the Cardinals, and the Rams. So, and you're talking about three different sports, obviously.
Yeah.
But let me ask you this: what does that work with an elite athlete? What does that help you as you work with I don't want to say normal Joe, but the regular guy?
Yeah. Okay. Yeah. I mean, shoulder mobility, whether it's a quarterback, a pitcher, or a golfer, is shoulder mobility. And whether they're, a professional athlete or a weekend warrior, we can still do things that can get them shoulder mobility, can get them spinal mobility, so that they can perform as best as they can. Okay. So, having the advantages of working with all those teams is working with other professionals and seeing other things that we can do to help the weekend warrior. Like I said, whether it's an orthopedic surgeon, whether it's a physical therapist, a trainer, a massage therapist, the athletic trainer. There's so many little different tricks that we all bring to the table that you learn. And so sometimes I physically can't do it. Listen, this is outside of my box, but I'm going to send you to this guy because this is in his box. So if somebody needs a shoulder surgery or something along those lines, working with the pro teams I have has allowed me to have a variety of knowledge where if I can't fix it, I know where to get them to, and also working as a team. So that's the one thing, like whether it was the Blues, the Rams, or the Cards, the medical team works as a team. We don't care who gets the credit, who fixes the person, but we all work together to achieve harmony. And that's what we can do. That's what we're doing at Family Golf. Working with their PGA pros, with Adam, working with Crash, his trainer, working with, the guys in our offices. We all work together for the common goal. And yes, we can help the average Joe go from an 18 to a 12. And I don't care what level you are. If you're not breaking 80 and all of a sudden you break 80, that's fine. If you're not breaking, 70, you break 70, that's fun. I don't care what level you are, but once you break through, it's fun. That's where the golf bug bites you, and that's where you're a golfer for life.
Well, I can hear it in your voice. You got it. You got the bug, or you've had it, because you know what it's about. And that's why I try and stress when we talk to the instructors, the fantastic crew of folks that teach over there. When I talk to Crash, I try and make sure that people understand this is for them. It depends on how far you want to go with it. Do you want to be Skip Berkmeyer? Rarely do people want to do that, but if you're going to play this game and spend the money, I'd rather see them enjoy it, Mike.
Yeah. And on that note is that and what this is going to allow you to do is that if you are, people think that, well, practice makes perfect, so I'm going to go out and practice. Okay. If you are practicing badly or poorly, you're going to be good at being bad. Okay. And so if you're not moving properly and you're hitting this big cut, you can practice it all you want. Unless you make some physical changes in your swing, in your body, in your practice, in your routine, you're not going to get better. You're going to be good at being bad. You're going to hit that cut better. You're going to hit that pull hook better. So you have to have some guidance. I mean, if Tiger Woods, the greatest golfer, can get lessons, if Jack Nicklaus can get lessons, so can us guys that work, and it'll help you in the long run, because then you're practicing with a purpose. And then when you practice with a purpose and you practice properly, that's when you're going to get better. Even though we can't practice hours at a time, the little that we do get to practice, if we practice properly and efficiently with the right mechanics, we're going to get better.
There's still a lot of people, Doc, that have never been to a chiropractor. And that may be because for a number of different reasons, but maybe they've never had any issues that have led them there. But
Sure.
What would you tell them, in layman's terms, what a chiropractor does?
Right. I think some people haven't gone because of some old stereotypes in that. And the chiropractic education and training has evolved. I mean, even since I've been out in 20 years, we're doing such a better job. Our continuing education and our knowledge is getting better and better. And there's a lot of really, really good chiropractors out there. And Logan here in town is really producing some of the best. And it is the best chiropractic school in the country. That's why I came here. So chiropractic is going to do a number of different things in it. There's a lot of different subspecialties. The performance world of helping you move better. There's people that do sinus work. There's people that do stuff to help when women are pregnant, to help ease their pregnancy. So there's a lot of different styles of chiropractic. The chiropractic education has evolved. Look for a chiropractor that would work with your family practitioner, that they'll have conversations with regards to your health. But it's evolved, and it's a great thing now.
Yeah, it's a super thing for so many people. My dad swore, a number of years ago with Doc Draghi. I mean, it just,
my mentors.
There you go. I mean,
Yeah.
It's real, and it helps people. And I think the other thing that people get involved with, and it's unfortunate, and Crash and I've talked about this, is they play around to golf and they feel pain. Their joints or this or that, or their the shoulder. I mean, at minimum, you guys can put together things that'll lessen that.
Yeah, well, so it's a really great question, or great statement, is that if you're getting pain playing golf, well, obviously you're doing something wrong with your swing that's causing pain. So then if you just chase the pain, well, why is it pain? Oh, there's pain in my shoulder, and you ice your shoulder after. But are we really getting to the root cause? Is your shoulder bothering you because you're not getting some rotation in your spine, your thoracic spine, or there's some other variable? We have to get to the root cause of it. And chiropractors, especially some of the guys and gals that have been trained with Titleist Performance Institute, have done a really good job at identifying, hey, this is the problem. Even though you have the pain source here, the problem is somewhere else. You address it, you treat it, you work with their trainer, you help them get some reinforcement techniques and exercises that'll help prevent that. And that's really key, is that that you get some treatment that'll help you prevent these injuries and identify the factors that cause the pain.
Doc, I mentioned your time with the Cardinals, the Rams, long time with the Rams, and the Blues. I've got to ask you, what was it like to be a part? And whether you're a ticket salesperson, the captain of the team, or the team chiropractor, you're part of the unit. What was the Blues Cup like for you?
Yeah. Well, I grew up in Canada, so the Stanley Cup is the most revered trophy by Canadians. It was surreal, and I think it was so much fun. Was like all my friends and families from back in the day, all the people I grew up texting me, they were so excited. And I remember in Game 7 sitting next to Chris Butler in the locker room, and he turned to me and he looked at me and it was a 4-0 game and there's 4 or 5 minutes left and he says, "We're going to win the freaking cup." And it was awesome and celebrating in the room with the guys and without the players you don't win. And so that team that Doug Armstrong put together and Chief and the coaching staff and Petro and all the players. I mean, if it wasn't for that crew, none of this happens, and they don't make the rest of us periphery people so excited. And it was outstanding, and I loved every minute of it. And it's a great memory.
Awesome. I bet it is. And you see kind of the family golf elevated performance and Performance Chiropractic with Dr. Michael Murphy, who will help you. He'll help you hit the ball further. Crash will strengthen you. Adam and his crew will teach you. What's the best way for somebody to get a hold of you? I've been putting on the screen the website. How do they get in touch with you, Doc?
Yeah, I mean, it's pretty easy. You can either do it through our website, which is a shortened version of Performance Chiropractic, perfchiro.com. You can contact us also through Elevated Performance and Crash, and obviously Family Golf Center. It's also another great way to get a hold of us. And in the next couple of months, we've hired a full-time doctor that's going to work there, Zach Cutler. Wow. And Zach played at Valparaiso, and which is a Division I school, and he's just finishing up his Titleist Performance Institute training right now. He's going to be coming to our office here in another few weeks. And Zach, as you know how hard it is, he qualified for the USAM at Oakland Hills a few years back while going to starting chiropractic school. And as you know, that's the kind of guy you want working on you, somebody who knows the golf swing, that can talk the language with the trainer, with the PGA professionals. And so we're really excited to put a full-time person there, and Zach's going to do a wonderful job. It's going to be a lot of fun.
I mean, a full-time guy there. I mean, it's just, it really is unbelievable. It's exciting. It's exciting stuff for you guys. And I thank you so much for being with us on this edition of the Lesson T. And Doc, best of luck to you. Continued success. We'll talk to you down the road.
Jay, I really appreciate the time today, and thank you for everything you do in the golf community. It's unparalleled, and we as fellow golfers really appreciate you. Thank you so much.
Thank you, my man.
Have a great day.